Hey guys, it's Dr. Connor LaValle here with Greater Good Chiropractic Care at 240 West River Drive in St. Charles, Illinois. Now we've been waiting about 6 months here to get this equipment in our office. Behind me here is a video fluoroscopy machine, which is a video motion x-ray that allows us to pinpoint where the problems are within the spine so that we can get a 3D view and correct exactly the problem itself and then leave the body alone to allow it to heal. So we're going to be doing a demonstration today, and I can show you exactly what I see and how we go about correcting the spine and really getting down to the root cause of what people come in for. We see a lot of people with neck pain, lower back pain, headaches, kind of the bread and butter issues, but allows us to go a little bit deeper with some of the more neurological conditions by getting really specific. So we're going to do that now today. So great to be with you. Okay, Joe, so we're going to bring this up a little bit. Now, go ahead and look over your right shoulder for me. Good, back to center. Good, now look over your left shoulder. Perfect, back to center. Excellent, now just take one step forward for me. Good, now bring your head all the way back. I want to see that extension. Good, back to center. Head all the way back again. Good, back to center. Now go ahead and take a step back, exactly where you were before. Perfect, Joe, you're doing great. All right, Joe, open your mouth nice and wide. Good, now laterally flex to the right. Good, back to center. Good, laterally flex to the left. Excellent, back to center. Good. Now, Joe, what I'll have you do is turn to the right so that your left shoulder is almost touching the back there, the bucky. Excellent, Joe. Go ahead and put your left arm up on there just for stabilization. All right. Now, Joe, go ahead and bring your chin all the way to your chest. Head down. Good. Okay, Joe, back to center. Good. Now bring your head all the way back. Good, Joe, back to center. Perfect. Okay, Joe, now one more time, head all the way down. All right, Joe, take a little step back for me. Little step forward now. Right there, now head all the way down. There you go. Okay, you are all done. Excellent job. Perfect, so we have the video fluoroscopy image right now, and we see the motion of the spine. And what we're looking for here is in the thoracic region, are those spinous processes right here, how are they rotated? Because that's going to give us an idea about which vector to use in order to make that specific correction. Now, we have the patient step forward because I want to see these three vertebrae coming down on each other, that T1, T2, T3. We can see that they're stuck up like that and they're not moving quite as nicely as they should. Now we move up a little bit to the upper cervical region. That's when we have the patient open the mouth. And we're looking for that C2 spinous process. How is that articulating and where is it in relation to the C1 vertebra up there? And those are these two lateral masses up there. So I want to see how the upper cervical spine is moving, how the rotation is doing, because we're going to turn the patient and look at them in flexion and extension. And this is the neck from the side. So a lot of patients who come in and have, chronic headaches, migraines, different conditions like that, I'm looking at the upper cervical region to see how the motion of that is doing, because that's going to tell me a lot about what's going on at the brainstem and those nerves coming up to the brain and to the rest of the body. Okay guys, so now that we have the video motion x-ray study complete, we're going to take you into the next room and show you the thermography, which really controls and shows us exactly how the nervous system's functioning and dictates when an adjustment is necessary.